Welcome to the Health Inquiry. On the evening of Saturday, July 11, 2026, the United States lost a long-serving leader when U.S. Senator Lindsey Graham passed away unexpectedly at the age of 71. His office initially shared that he had passed away following a brief and sudden illness shortly after returning home from a trip to Ukraine. However, emergency medical logs and news reports quickly filled in the details. Emergency responders were called to his home for severe chest pain, and the senator went into sudden cardiac arrest soon after. His passing shocked the nation, but it also cast a spotlight on a critical health crisis that affects hundreds of thousands of families every year. To honor his memory and protect our communities, we must understand what happened inside his heart and learn how we can keep our own hearts beating strong. What is cardiac arrest? The electrical system of the heart. To understand what happened to Senator Graham, we need to look at how the heart works. Your heart is a muscle about the size of your fist, located in the middle of your chest. Its main job is to act as a pump, pushing blood to your brain, your lungs, and every other part of your body. The blood carries oxygen, which your body needs to live. But how does the heart know when to pump? It uses an internal electrical system. Deep inside the upper walls of the heart is a tiny group of specialized cells called the sinoatrial node, which acts as the heart's natural pacemaker. This pacemaker creates tiny electrical signals that travel down paths through the heart muscle. As the electrical signal passes through, it tells the heart muscle to squeeze. In a healthy person, this happens in a perfectly timed rhythm, usually between 60 and 100 times every minute. You feel this steady rhythm as your pulse or your heartbeat. Cardiac arrest happens when this electrical system suddenly malfunctions. Instead of a steady, coordinated squeeze, the electrical signals become completely chaotic and disorganized. The heart muscle begins to quiver violently like a bowl of jelly instead of pumping blood. This chaotic state is called ventricular fibrillation. Because the heart stops pumping, blood instantly stops flowing to the brain and the rest of the body. When cardiac arrest occurs, a person will collapse immediately, lose consciousness, and stop breathing normally. Without help, it leads to death within a matter of minutes. People often use the terms cardiac arrest and heart attack to mean the same thing, but doctors know they are completely different. Think of your heart like an appliance. A heart attack is a plumbing problem. This happens when one of the pipes, called coronary arteries, carrying blood to the heart muscle gets blocked by a clot. Blood cannot get through, and that part of the heart muscle begins to starve for oxygen. During a heart attack, the heart is usually still beating, and the person remains conscious. Cardiac arrest is an electrical problem. This happens when the electricity fails completely, the power grid drops, or a short circuit causes the machine to stop working instantly. The pump stops moving entirely. The connection, a plumbing problem, can lead to an electrical problem. If a heart attack is left untreated, the damaged heart muscle can trigger a massive electrical short circuit, causing the person to go into cardiac arrest. Why does it happen? The underlying causes. Cardiac arrest rarely happens out of nowhere. Usually, there is an underlying problem with the heart that creates the perfect conditions for an electrical short circuit. Scientists and doctors have identified several major reasons why this happens. 1. Coronary artery disease, plaque buildup. This is the most common cause of cardiac arrest in adults, especially older individuals. Over many years, fatty substances, cholesterol, and calcium can build up on the inside walls of the arteries that feed the heart. This buildup is called plaque. If a piece of plaque cracks open, a blood clot can form on top of it, completely blocking the artery and causing a heart attack. The sudden loss of oxygen alters the electrical charge of the heart cells, sparking the chaotic signals that lead to cardiac arrest. 2. Scar tissue from past structural damage. If someone survived a heart attack in the past, or if their heart was damaged by an infection, that damaged area heals by forming scar tissue. Unlike normal heart muscle cells, scar tissue cannot conduct electrical signals. When the heart's normal electrical pulse hits a patch of scar tissue, it can get trapped, split, or spin around in circles. This creates an electrical loop called a reentrant circuit that can instantly spin the heart into a lethal rhythm. 3. Enlarged or weakened heart muscles, cardiomyopathies. Sometimes the structure of the heart muscle itself changes. It can become stretched out and weak, dilated cardiomyopathy, or abnormally thick and stiff, hypertrophic cardiomyopathy. When the heart walls are stretched or thickened, the electrical pathways get stretched and disrupted as well. Hypertrophic cardiomyopathy is a genetic condition that is often the hidden cause when young, seemingly healthy competitive athletes suddenly collapse on a sports field. 4. Genetic channelopathies, microscopic signal errors. In some families, individuals are born with perfectly shaped hearts, but the microscopic gates on the surface of their heart cells, called ion channels, do not work correctly. These channels control the flow of sodium, potassium, and calcium ions that generate each heartbeat. Conditions like long QT syndrome or Brugada syndrome are genetic defects in these gates. They can cause the heart to take too long to reset after a beat, making it highly vulnerable to a sudden, fatal electrical storm. How we can prevent it. A scientific strategy. Preventing cardiac arrest is divided into two parts. Primary prevention, keeping your cardiovascular system healthy so you never develop a dangerous heart condition. And secondary prevention, protecting people who already know they have a high-risk heart condition. Primary prevention, keeping your blood pipes clean. Because coronary artery disease is the #1 driver of cardiac arrest, protecting your blood vessels is your absolute best defense. Medical science shows that we can prevent plaque buildup through daily lifestyle habits. 1. Heart-healthy nutrition. Focus on eating a diet rich in vegetables, fruits, whole grains, and lean proteins, while minimizing trans fats, heavy sodium, and highly processed sugars. Keeping blood vessels clear prevents the ischemic events that trigger electrical failure. 2. Regular physical activity. Engaging in moderate exercise like brisk walking, cycling, or swimming for at least 150 minutes per week strengthens the heart muscle, lowers blood pressure, and improves overall vascular function. 3. Managing key health metrics. Work with a doctor to routinely check and manage blood pressure, cholesterol levels, and blood sugar. If these metrics are high, lifestyle adjustments or standard protective medications, like statins or antihypertensives, can stabilize blood vessels and prevent future emergencies. Secondary prevention. High-tech shields for high-risk hearts. For individuals who have already survived a heart attack, have a weakened heart muscle, or carry a genetic heart condition, modern medicine provides incredibly reliable lifelines. 1. Implantable cardioverter defibrillators, ICDs. For individuals at exceptionally high risk, surgeons can implant a small, battery-powered device under the skin of the chest. This device connects to the heart via thin wires and continuously watches the electrical rhythm. If it detects that the heart has gone into a chaotic cardiac arrest rhythm, it instantly delivers a targeted internal electrical shock to reset the heart back to normal, saving the patient's life in seconds. 2. Protective medications. Doctors frequently prescribe medications called beta blockers to high-risk patients. These medications lower adrenaline levels in the body, shielding the heart from stress and calming down abnormal electrical activity. Because many heart muscle disorders and electrical channelopathies are passed down through families, knowing your family medical history is vital. If a first-degree relative, a parent, brother, or sister, died suddenly and unexpectedly before the age of 50, you should share this information with your doctor. They can order special tests like an electrocardiogram, ECG, or an echocardiogram, an ultrasound of the heart, to see if you share the same hidden traits long before any symptoms appear. Your practical emergency action guide. The chain of survival. Even with the best prevention, cardiac arrests still happen. When someone collapses from cardiac arrest, their survival depends entirely on the people standing around them. Every single minute that passes without help reduces their chance of survival by about 10%. If you see someone collapse, you must act immediately using the chain of survival. Step 1. Check for responsiveness and breathing. Tap the person firmly on the shoulders and shout loudly, "Are you okay?" Look closely at their chest. If they do not move, do not answer, and are either not breathing at all or only making sporadic gasping sounds, called agonal breathing, they are likely in cardiac arrest. Step 2. Call 911 immediately. If you are alone, call 911 on your phone and put it on speakerphone so your hands are free. If other people are around, point directly at someone and say clearly, "You, call 911 right now and go find an AED." Step 3. Begin hands-only CPR, chest compressions. Place the heel of one hand in the very center of the person's chest, on the breastbone. Place your other hand directly on top of the first hand and interlock your fingers. Lock your elbows straight and position your shoulders directly over your hands. Push straight down, hard and fast. Depth. Push down at least 2 inches deep. Speed. Push at a rate of 100 to 120 compressions per minute. A perfect way to keep this rhythm is to push to the beat of the famous song "Stayin' Alive" by the Bee Gees. Allow the chest to come all the way back up between every push. Step 4. Use an automated external defibrillator, AED. An AED is a portable, smart electronic box found hanging on walls in many public spaces like schools, airports, and malls. Open the box and turn it on. The machine will speak out loud and tell you exactly what to do step by step. It will tell you to peel sticky pads and place them on the person's bare chest. The machine will then listen to the heart's rhythm automatically. If it detects a cardiac arrest rhythm, it will instruct you to push a button to deliver an electrical shock. This shock stops the chaotic rhythm, allowing the heart's natural pacemaker to take back control. Conclusion: empowering our communities. The tragic loss of Senator Lindsey Graham reminds us that cardiovascular emergencies can affect anyone, regardless of who they are or where they have traveled. Cardiac arrest is a rapid and terrifying event, but it is not a mystery. It is a defined electrical failure driven by understandable physical and genetic causes that we can screen for and prevent. By making smart, daily choices to keep our blood vessels healthy, speaking with our doctors about our family medical histories, and learning the simple steps of CPR and AED usage, we can transform ourselves from passive bystanders into an active line of defense. Understanding the heart is the first step towards saving a life. Thank you for tuning in. If you want to continue exploring the deep science of health, happiness, and longevity, make sure to hit that subscribe button for The Health Inquiry.